Former NFL quarterback Bernie Kosar is back in the hospital facing serious new health issues. According to his social media, he has E. coli blood poisoning, which can be life-threatening. The diagnosis comes after the Cleveland Browns legend received a liver transplant last month. Kosar has publicly acknowledged battling alcohol and substance abuse during his football days and says it contributed to his health problems, which eventually led to his liver transplant. Here to talk more about this is Dr. Basem Alkurdi, a transplant hepatologist and medical director of Transplant Oncology with Tampa General's Transplant Institute. Doctor, thank you so much for being here.
Thank you for having me.
Well, let's start with the basics. What are the main functions of the liver that are so vital to our health?
Yeah, the liver is a very powerful and essential organ in our body. It performs hundreds of functions. To mention few, the liver is a factory. It absorbs food, drinks that we ingest, and process these nutrients, vitamins, and minerals to produce energy. It also works as a storage space. It stores the excess fat, other nutrients that we don't immediately need, and guarantees a stable supply of energy for our body in real time and even while we're asleep. Also, it's important to mention that the liver is very essential for waste management. Our liver filters the toxins, the drugs, the harmful waste that our body produce, and safely eliminates that out of our body. If not eliminated, these toxins can build up to dangerous levels. So without really a functioning liver, simply survival is not possible.
We know alcohol abuse can do serious damage to someone's liver, but how do you determine which patients need a transplant?
Yeah, so we do use a structured evidence-based approach to determine which patient is expected to recover with medical management without transplant and those who really will need it. So, for example, we assess that using validated clinical scores. You sometimes hear of MELD score, MADRI score, Lilly score, which has, to a good degree, good ability to predict short-term survival. We do follow these patients very closely. We usually have them in the ICU till the recovery if their disease is mild or moderate, or till transplant if their disease is severe and requires liver transplant.
Bernie Kosar is 62 years old. He's also battling Parkinson's disease, and now he's back in the hospital. Can you talk more about his latest diagnosis and what his journey has been like since his transplant?
Yeah, so that's a very good question, and I'm sure a lot of people are asking the same. However, you know, I don't have information or clinical information about his exact condition or transplant details. That's obviously a private medical information. I can give you a typical journey of a patient like him. Usually patients right after transplant, they do spend a few days in the medical ICU. We closely monitor them. When they're more stable, they go to the floor, and when for maybe a few more days, and when they're more stable, they go home. They will likely have frequent follow-ups, multiple labs to check their liver function, medications level, and also screen for complications like rejection or even infection like Bernie Kosar. Those patients will need to be on immune suppressive medications, the anti-rejection medications, lifelong. It basically assures the liver is accepted and not rejected. So the journey can be long. I'm sending my best wishes to Bernie, and hopefully he will be discharged from the hospital back home safe. Maybe he will require some extended course of antibiotics, but he like we do here, he'll be closely followed by his team and to a long-term recovery.
Yeah, we were hoping for some positive news as well. And just quickly, as we are about to head to break, the holidays, they are a time when binge drinking tends to spike. Do you have a final message? What would you want to tell our viewers to know just about the serious effects of alcoholism that you see in your practice every day?
Yes, yes. So I want to clear a few misconceptions about alcoholic liver disease. First, a holiday binge can actually be more dangerous than people think. Even short binges of heavy drinking can trigger severe acute alcoholic hepatitis or pancreatitis. Um, Also, people imagine cirrhosis as something that only happens after decades of heavy drinking or only in alcoholics. That's not true. Liver disease happens quietly. For years, patients may feel fine, be functional, stable jobs, and even have normal labs. The silent nature of the disease is the most dangerous part of it. So a lot of times, by the time they're symptomatic with jaundice and other symptoms, it might be irreversible without liver transplant.
Some crucial advice. I hope everyone takes it to heart. Doctor, thank you so much for joining us.
Thank you for having me.
We'll be right back.